So basic spinal health care. Okay, so if we start with the spinal health care, first we have to understand the control of our body comes from the nervous system, which starts from the brain. The first thing, the brain has a brain stem, and the nerve supply that goes to the body goes through the brain stem, from the brain to the brain stem. It has to pass through the cervical curve. So oftentimes, if you don't think about your own posture is very, very important. Look at this picture and look at yourself. If you have somebody that can take a side view of you, you can see how your posture is. And from there, you can check to see if you're in phase 1, phase 2, or phase 3. Oftentimes, you might find yourself in phase 1 or phase 2. In phase 3 and 4, it's a lot harder for a chiropractor to correct your posture. But if you're only in phase 1 or 2, you may still have a chance to be able to restore your curve. Okay. Now, the head in relation. Why do we start with the neck? Because neck is the first, from your brain to your body, has to pass through the neck. And if you think about this, usually the head weighs about 8 to 12 pounds. With this head straight on top of your spine, it's 12 pounds straight down to your body. But if you're slouched, your head is leaned forward a little bit, that could multiply your weight of your head onto your spine and to your upper body. That could multiply into 2 times, 3 times, 4 times, even more. So you can see why neck pain, shoulder pain, and back pain is common. In this picture on the left side, you can see that. With this, you can see right here, most of the time when people sit, they have their mid-back touched to the back of the chair. So their pain would most likely be in middle back. Now, if you're the type that don't really touch, then your pain will be more in the lower back. So depending on how you sit, if your back is touched much higher, but your head is leaned forward, you may have more of your neck and shoulder discomfort in the higher area. So these are the considerations of chair, how you sit, where your screen are. All these has an effect. Now, how would we check the spinal deformity on a person? It's really easy. If you have a friend or partner, your spouse, or you want to check on your kids, all you have to do is have their shirt off, and you can see, have them lean forward. Once they lean forward, if their spine is straight, then it is actually normal. If they're standing straight and they have a curve, but when they bend down, they don't have a curve that's nice and straight. This is what we call functional curve. If you're standing and they have shoulder height and their back with shoulder and hip is uneven, and when they bend over, they have a curve still with this high rising ribcage side, that means this is structural. Structural curve is probably harder to correct versus functional curve. This is a lot easier to correct. That means it's habitual related from your posture and it's muscle imbalance. Okay. Now, how do we have degeneration? In general, degeneration happens mostly in cervical and lumbar. And the most common area is cervical 4, 5, 6 and lumbar 4, 5. Thoracic, we also have most common area around 10, 11, and 12. But everyone varies. That's just the most common area. If you ever had an x-ray, you could look at the screen. On the first screen, you can see that there's loss of curve. Normally, cervical curve should be curved forward. In this case, this is slightly reversed. Oftentimes, we find people with a straight curve or reverse curve as the first sign of degeneration. Then in phase 2, we have loss of, you can see that there's a loss of curvature. Besides that, you have loss of disc space. Notice that you have several normal ones right around here. And then earlier I said most degeneration starts at C4, 5, 6. See, between 5 and 6, that is thinner, a lot thinner in this. Okay. Then in phase 3, we will see, besides the curve loss, degeneration of the disc, you can see this pointy, sharpy area sharp. That's this called bone spur. Oftentimes we hear about bone spur, this little lip like a bird's beak, and it's sharp and pointy. Bone spur is normal. It's part of the growth process to stabilize your weight, to actually help support your cervical, your head weight, to help you stabilize for your movement and how you use your head and your shoulder. When you actually have an x-ray and you have a finding of bone spur, don't freak yourself out. It's been there for some time. It didn't happen overnight. It didn't happen over a month or two. It actually has been there for years. And I want you to keep that in mind. You didn't have pain all those years. Maybe it was only because yesterday you did something a little heavier, or a little heavier on your lifting, turning, twisting, or maybe you had a car accident that flared it up. Often after a car accident, sports injury, or some sort of pain, tingling, numbness, soreness, achiness, you went to the doctor and told them about it. They took an x-ray, and all of a sudden you see the bone spur, you see the degeneration, and you're freaking out, thinking about surgery right away. Well, do remember, this has been there for some time. Then you have phase 4, which you can see you also have loss of bone density. Of course, it's not easy for you to identify these x-rays. It takes an expert to look at these and evaluate it for you. Your doctor can tell you this. But on the last stage where you even have bone spur in the back, besides the bone spur in the front degeneration, you also have it in the back in the facet joints. This is when you find yourself have limited range of motion. You find yourself that with turning, there's sharp pain in any movement, up, down, side to side. Somehow with motion, there's pain. And sometimes even sleeping is painful. Whenever you have pressure in the back, whenever you have pressure in that joint. Now, once again, these degeneration didn't happen over one night or days or months. It's gradual for years. Now, how come you didn't have pain all those years and suddenly you have it? Well, most likely you triggered something. You might have pulled a ligament, a muscle. You might have had a little impact. Maybe you were doing the upside down new yoga pose, or you didn't have, you hit your head into something and you were looking for something. You lift your head up, you hit the back of the shelf, or something might have, you were sitting in a car, might have had a jolt. All this could be a possibility of aggravation. Okay, so then let's look at the next one. Why is cervical very important to us? Why is neck very important? Why is the head posture position very important to us? That is because we have artery that actually passes through. Artery right here, which you can see that pass through, we call this the vertebral artery. This is actually inside the bone structure of your cervical bones. And that goes all the way up. Now, can you imagine if your bones are degenerated, your limited range of motion, and yet we're still turning our head quite frequently in C1, 2. Oftentimes, this could be one cause of dizziness, vertigo, okay? It could be multiple causes of headache. It could be some sort of chronic things where you realize that you could be turning and feeling some discomfort. All this can be an impingement on the nerve or the artery, and you may have things going to the back of your head. Those are the possibility. So in essence, it's very important in how you maintain its flexibility and function. Now, if we go back and talk about the function of the spine. Okay, function of the spine is very simple. 3 things that it really does for our body. Weight bearing, think about your head on top of your spine, cervical spine. Think about the shoulder and your head on mid back to the lower back to the lumbar spine. Without the cervical or the thoracic or lumbar, the spine is very important right in the middle for movement. Can you imagine without the spine, you cannot rotate, you cannot nod your head or turn your head. You probably won't have the ability to bend and flex. This is the most important center core for the movement of our body. Now, the third part, which I think is the most important, is it protects the nervous system. Nervous system goes from the toes all the way up to your brain, and then also from your brain all the way down to your toes. Can you imagine that? What if there is interference in between somewhere in your spine? Would you be able to feel your toes? Would you be able to feel the response and be able to respond when you accidentally step onto a nail? Usually think about how fast that reception is. The minute you felt something sharp, the minute your brain tells you to jump, it's actually quite fast. If there's an injury, we think about, yes, there's an injury. But oftentimes I have patients that showed up and don't remember or recall they have any injury. Injuries to the spine can occur in multiple ways. When we say trauma or repetitive stress, trauma is the most common thing that you see now as of car accident, sports injury, a direct hit. A simple slip and fall onto the concrete, that's more of a direct trauma. Repetitive stress, most common repetitive stress. Think about how many clicks have you clicked through a day of working. Think about how often you have actually grabbed onto things, holding onto your iPad or iPhone, and you tab with your wrist or trying to swipe up, down, or side to side on your phone or on your iPad. That's repetitive. Oftentimes, think about when you brush your teeth, the motion of your wrist, and also when you walk. How many steps have you walked? That's also repetitive motion. When you sit, how often have you turned and looked with your head? These are all repetitive stress through time that we don't know. Normal stress on a healthy spine would be where your head is, where your lower back is in relation to how we sit. Okay, driving, with you driving back, a long distance driving, where's your head? With your head forward, with your arms just driving on the wheel, there's also weight bearing from your head to your shoulder. That's what we call normal stress on a healthy spine, when the spine is actually straight. Now, there's other things such as a normal stress on an abnormal spine. When we say abnormal spine, that is somebody with scoliosis, or not quite as bad as somebody with a curve in their spine. Often this curve could be caused by a general repetitive habitual sitting posture, a general repetitive right arm usage. Gradually, the dominance of that muscle will shift your body into a curve. Okay? Now, when you have a curve, you think about this, we're going to go into the disc anatomy. Your curve could be caused by a repetitive stress, your body leaning forward, turn to one side. And through 1 hour of sitting, 2 days, 3 days, weeks, if you never switch your monitor to the center, or it's been always on the right versus left, you probably have pushed this disc to one side. Now, disc herniation is also something that we often see and find out after people have lower back pain for some time. If your disc slowly protrude, we call disc protrusion or disc bulge. It could be more for the lateral side, meaning you could have a disc bulge more towards the center of the spine or more towards the outside of the spine. The impingement on the nerve can cause discomfort, such as soreness, tingling, numbness. It could be down the leg. If this is the lower back disc, it'll be in the leg region. If this disc is in the cervical region, you will feel it in your hands, fingers, arms. You could have soreness, achiness, tingling, numbness, even when you're sleeping. If it's in the root level, when you sleep, you may feel it. When you wake up, you may feel it. If it's more local, you only feel it when you use it. So with the disc herniation, we also have the post-lateral, there's central-lateral, there's quite a bit. I'm just running through some of these descriptions for you. Whenever it's pinched more only on one side, you only get one side feeling. If it's on both sides, it could be more towards the center and it'll run. Now, for disc herniation, when it gets worse, it actually protrudes and it disrupts through the annulus fiber, which is the white part. Annular fibers are actually really tough. For someone to actually have this protrusion and to have a burst extending out to the lateral space, that means the person has gone through some sort of trauma. It could be most likely some sort of sports injury when they're young, or a car accident, a direct blow and fall. Okay, least likely to be somebody who just sneezed and had a back pain and got an MRI and X-ray and found out they have disc problem. We often hear stories such as I sneezed and I couldn't stand up. Or I was sitting on the sofa watching TV. Suddenly, I couldn't get up without trying to avoid some sort of sharp pain on one side. That means it's been accumulated for some time. It just was waiting to happen. Now, oftentimes sequestration, this only happens when you already have herniation that's bad enough that you might have had a fall or a car accident. Then that could cause this sequestration, meaning a burst. At this rate, as a chiropractor, we won't be able to help you for sure. You have to go to a surgeon. And with that, the surgical procedures would be able to help you. If this, you can see that on this picture, the actual protrusion has actually impinged onto the central nervous system. This is more than just the lateral. Touching the central part could actually affect the entire segment below that. The entire segment below that could be complete numbness on both sides. It would not just be one side in this case, it would be bilateral. When we hear bilateral, it's usually pretty serious. In our career, and when we hear bilateral tingling numbness, that's most likely surgical case. If anything that's bilateral or it runs today's on the right, tomorrow's on the left, that raised a big flag for us to be worried about patients. Oftentimes, most common nerve feelings that we go through: soreness, achiness, pain, numbness, weakness, tightness, throbbing, pressure pain, something just weird. All this is the nerve that sends it. That's our nervous system. Okay, when it hurts, here's the tip. Most common thing that we need to consider is when you have lower back pain, sitting versus standing, which will be better. If you have pain during sitting, then I recommend standing. Now, why is that? Sitting gives the most pressure on the lumbar. Standing takes it off a little bit more. Okay, standing versus laying down. If your sitting is painful and your standing is also painful, then standing is also putting weight bearing on the lumbar, then you might as well lay down. Laying down, your spine does not have as much pressure from your head, shoulder, and the entire body onto the lumbar. Now, laying down for some people, even laying down on their back is painful because their disc is swollen. So in that case, we have what we call prone and supine. Prone is laying face down. Laying face down, your spine's on top. It would be better than laying on your back, which is what we call supine. So in the case of pain, these are the things that you can do. And then pain equals ice. So please make sure that you ice while you have pain. Often people ask, who needs spinal checkup? Yes, anyone with a spine. As long as you have a spine, you should get a checkup. It's almost like going to a dentist. If you have a set of teeth you want to maintain, then you should go for a checkup. Who needs spinal alignment and treatments? Often people think, well, I probably don't need any alignment. But actually, as long as you feel pain, whether it's neck, lower back, if you know you have scoliosis, even though you have no pain, you should get checked up and alignments, because it's often that you would have more misalignment than a person with a normal spine. Aging, arthritic, sciatica, frozen shoulder, any of these, as long as you have a nerve in your body, you will feel pain. So with that said, the tip for today, which is the tip from leaving my office, this is the key. The 5 steps to a healthier life and a healthier spinal care is daily stretching. I think I've emphasized enough every time when you come and get adjusted and get treated. I ask you to do your homework, which is stretching. Stretching is like brushing teeth. Adequate strengthening. This does not need to be every day. It could be 2 to 3 times a week. Constant good posture. This is the hardest, but also the easiest to prevent pain. If your posture is good, you have less uneven wear and tear. So constant good posture is very important. Now, balanced nutrients, that's for the nutrients of your joint, and regular spinal checkups. I would recommend twice a year for minimum. Depending on your age, the maintenance level increase. When you're young, only when you have injury, you would want to get checked up. When you get much older, you probably will want checkup to help you with your joint lubrication, mobility. It could be as frequent as once a month. So this is the end of my lecture for you.